Welcome to Comcare's webinar on 2025 to 26 Regulatory Priorities and Risk Management. My name is Eva Materia and I'm the Director of Regulatory Performance at Comcare. I'm pleased to be your host for today's event. On behalf of Comcare, I would like to acknowledge the traditional owners of the lands on which we are virtually meeting today. I'm joining you from Melbourne, so I'd like to acknowledge the Wurundjeri people of the Kulin Nations who are the traditional custodians of this land. I would like to pay my respect to their elders past and present and acknowledge the contribution they have made and continue to make. I also extend that respect to other Indigenous Australians and Torres Strait Islander people who are present. Before we begin, I'll just go through a little housekeeping. This session is being recorded. However, only myself, the presenters, and the slides will be captured in the recording. This recording will be made available on our website in the coming weeks. You may notice that your microphone and camera are not able to be turned on. However, the Q&A function we have is available for you to submit any questions that you might have. We do have some time dedicated towards the end of the webinar for our presenters to respond to your questions, and we'll do our best to get through all of those. At the end of the session, we will also ask you to take a quick moment to provide us with some feedback on the event, as this will help us shape our future sessions. We've held these sessions at this time of year over the past few years as a way to connect with the jurisdiction and also share an update of our planned proactive activity for the coming financial year. So today's agenda will include hearing about the outcomes of our 2024 to 25 Regulatory Priorities and Inspection Program, and then an introduction of the 25-26 Regulatory Priorities. We're then lucky to be joined by Dr. Tristan Casey, who will be presenting on effective risk management. And following Tristan, we will hear about how Comcare inspectors will be working with you through the Proactive Inspection Program. Lastly, and importantly, we will have our presenters respond to your questions that we have received through the registrations and also through the live Q&A of today's event. It is important to note that the Regulatory Priorities and Inspection Program that we'll be referring to today applies to organisation in the Commonwealth Work Health and Safety jurisdiction. So this includes federal government departments and agencies, as well as some licensees. If your organisation is local or state government or a private organisation, it is likely that you are covered by a state or territory WHS regulator and not Comcare. I'll now invite Nick Brady, our Senior Director of National Operations, to commence our first session. Thank you, Nick.
Thanks, Eva. Hi, everyone. I'm Nick Brady, Senior Director, National Operations in the Regulatory Group at Comcare. I would also like to acknowledge the traditional owners of the lands on which we are meeting today and pay my respects to elders past, present and emerging. I'm joining you from the land of the Wurundjeri people, and I would also like to acknowledge all the lands that people in this webinar are joining from today. Today I'll be sharing a recap of our regulatory priorities for the 2024-25 period. Comcare's proactive approach aims to support PCBUs so that they can meet their duties and obligations under the WHS Act. Within this, there are three objectives which are set out on the slide: to ensure PCBUs have fundamental WHS systems or arrangements in place, to enable PCBUs and the broader jurisdiction to adapt in an effective and timely manner to significant changes in the WHS environment, including legislative changes, and to reduce harm in the jurisdiction by targeting significant causes of harm identified through our data analysis. Comcare identified 6 regulatory priorities in the 24-25 period that are in line with these objectives. They were psychosocial hazards, body stressing, contractor management, being hit by moving objects, silica, and WHS management systems. Having regulatory priorities ensures that the additional focus is placed on specific WHS risks with a prevention focus. Comcare identifies that using a risk-based and evidence-led approach, including the review of Comcare's regulatory and claims data, Safe Work Australia's National Work Health Safety Strategy, and other work health safety intelligence. These priorities also assist in the delivery of the broader organisational Comcare strategy to prevent work-related injuries. Throughout the year, work was conducted within our regulatory operations group to scope and deliver activities to address these priorities. I'll now provide a recap on this work, and then Justin Napier will announce our priorities for the upcoming financial year. Psychosocial hazards. Psychosocial hazards are aspects of work which have the potential to cause psychological or physical harm. Prevention of harms associated with psychosocial hazards is a key focus area for all WHS regulators. You should be aware of the amendments to the WHS regulations that took effect on the 1st of April 2023, which introduced the risk management approach for psychosocial hazards. While Comcare continues to respond to psychosocial incidents using a risk-based approach, we now have launched the Psychosocial Inspection Program. This is designed to assess how well organisations are meeting their obligations to manage psychosocial risks and hazards. The program officially commenced in early 2025 following the pilot program, and inspections are being implemented as we speak. A dedicated webpage for the program was developed, including a PCBU guide to the program, as well as a video explaining what was involved. And there's a link in the pin post if you'd like to read more about this. The program is delivered by Comcare's dedicated psychosocial regulation team. In addition, the team built capability across the broader inspectorate, which included providing one-on-one case support and delivery on training on topics such as trauma-informed regulation, systems-based regulation, and on the managing psychosocial hazards at work code of practice to further strengthen inspectorate knowledge and skills. For PCBUs, the team continued to provide guidance and education across the jurisdiction and help to build organisational capability in managing psychosocial risks. This included targeted presentations during Safe Work Month, the HSR Forum, the Psychosocial Health and Safety Forum, the Small Agency Forum, and Comcare's National Conference. Contractor management. Contractor management is complex and often involves more than one duty holder and a co-regulated workplace. The Australian WHS strategy also identifies complex contract management arrangements as a persistent and ongoing work health and safety challenge. Our incident notification data consistently shows a large proportion of notifications involve contractors. We frequently receive inquiries regarding the management of contractors, including notification requirements, risk management and controls, duty of care, and consultation. In 2024-25, we continued to respond to incidents and WHS concerns and provide information and advice where contractors were involved. We've also developed and provided our inspectors with additional resources to refer to ensure contractor management requirements are being addressed. Silica. Exposure to silica and related illnesses remain a priority in Comcare's jurisdiction. While the risk associated with exposure to this substance affects a limited number of our PCBUs, the risk itself is significant. The risk of exposure is predominantly within construction projects in our jurisdiction, and this has been managed proactively by our major infrastructure projects team with a focus on silica controls. Where incidents and concerns arise, we have responded through our regional inspectorate teams. Inspections are undertaken for all workplace exposure standard exceedances. In these inspections, we review causes and controls in place prior to the exceedance and what remedial actions and improvements have been put in place to control silica post-exceedance. Comcare also has representatives on the Victorian Major Infrastructure Consultative Committee who meet quarterly to discuss major infrastructure projects, incidents that have occurred, and high-risk activities also. As a national regulator on the committee, we're able to share findings from across our jurisdiction. This is a valuable opportunity to learn from each other's experiences in different locations and with different risks. Another priority was body stressing, which aligned to the Comcare prevention strategy for 2022 to 25. Body stressing injuries are linked to repetitive and strenuous work, often leading to musculoskeletal disorders and negative psychosocial impacts. The main causes are manual handling and computer work. These injuries can affect both physical and mental health, potentially worsening existing conditions like anxiety and depression and other mental health conditions. Over the past few years, we have addressed this priority through engaging with internal and external stakeholders to inform and gain further insights. Comcare is represented in various working groups that have a focus on understanding and addressing musculoskeletal disorders. For example, we are part of a Hauser musculoskeletal disorders working group made up of WHS practitioners. In 24-25, the working group focused on regulating slips, trips, and falls at level, recognising their alignment with body stressing and the high cost of related claims. The group is committed to better understanding the dynamic issues related to musculoskeletal disorders and identifying opportunities for improvement in this space. We also have representation on the WHS Ergonomics Regulators of Australia and New Zealand group. Our participation in this group allows for informal information sharing across jurisdictions, discussing regulatory issues, barriers, and potential controls. Being hit by moving objects is one of the most common causes of workplace injuries in Australia. An analysis of data showed that the highest number of incidents occurred in roles in construction, transport, and logistics industries. Given the prevalence and the impacts of this risk in specific industries, we address this priority in a targeted way within the work of our major infrastructure projects team. Through the assessment of historical incident notification data, we were able to identify key issues pertaining to these incidents, including risk assessments and contractor management. We'll continue to work collaboratively with PCBUs to address findings and opportunities for better practice. While body stressing and being hit by moving objects remain identified causes of harm in the jurisdiction, we will not be continuing these as part of our specific priorities for 25-26 based on our assessments. However, we will continue to monitor trends, provide information and advice, deliver education products, and conduct compliance assessments as part of our inspectorate functions on these topics where it's relevant. Our last priority is work health safety management systems. These systems are important to ensure that workplaces have robust systems in place to manage health and safety effectively. Because of this, it's a priority area that underpins our ongoing 4-year inspection program cycle. Last year, this included initiatives to promote better practice and compliance with the WHS Act and regulations. We delivered this through our regional engagement activities with a rollout of the WHS Consultation, Cooperation and Coordination Proactive Inspection Program. We conducted over 200 proactive inspections across our jurisdiction to ensure that PCBUs have arrangements in place for effectively meeting consultation, cooperation and coordination requirements as per Section 47 of the Work Health Safety Act, and the critical role between workers, PCBUs, worker representatives, HSRs, and its officers were operating effectively. Throughout these engagements, our inspectors worked with PCBUs to identify gaps in the processes and discuss better practice. During the inspections, PCBUs were asked to demonstrate that appropriate systems or arrangements were in place. What we found was some PCBUs were unable to demonstrate that their processes met the requirements of Section 48 of the 49 of the Work Health Safety Act. This section provides detail on when consultation is required, including when identifying hazards and assessing risks, making decisions to eliminate or minimise those risks, when proposing changes that may affect the health and safety of workers, and when making decisions about health and safety processes and procedures. Some PCBUs were also unable to demonstrate that their processes met the requirements of Section 48 of the Work Health Safety Act, nature of consultation. This section outlines that consultation requires sharing of relevant information about matters with workers, and that workers are given a reasonable opportunity to express their views, raise work health safety issues, and contribute to decision-making processes relating to the matter, and have their views taken into account by the PCBU, and that workers are advised of the outcome in a timely manner. During the inspection, a high number of PCBUs were further unable to demonstrate consideration of worker and worker representatives' feedback. That feedback was received from workers and HSRs relating to policies, procedures, and risk assessments. And some were also unable to demonstrate that any feedback was sought at all. While consultation may not always result in agreement, it should be the objective of any process. And while it doesn't mean that the PCBU needs to action any feedback specifically, there does need to be genuine consideration and consultation. On the other hand, from the issue resolution perspective, many PCBUs were able to demonstrate that they had a policy in writing. However, a high proportion did not demonstrate that their processes met the issue resolution requirements as outlined in the Work Health Safety Act and regulations. These should include providing clear information to any party that the issue can commence the issue resolution process and how to do so, what the parties must have regard to, such as the degree and immediacy of the risk, who is impacted by the issue, the measures to be implemented to resolve the issue, and who is responsible for implementing these measures. The procedure should also have clear guidance as to when and how to seek regulator assistance if the matter remains unresolved, as per Section 82 of the Work Health Safety Act. Where gaps were identified in the systems following our inspection activities, inspectors work collaboratively with PCBUs to work towards better practice. The outcomes of the 2024-25 inspection program will also be used to scope additional resources for the jurisdiction and further guide the inspectorate in the upcoming year. Our proactive engagements have been well received, and this was shown in the annual Comcare 2025 employer survey results, which indicated that employers are increasingly satisfied with the proactive inspections conducted by the work health safety inspectors. This highlights some of the importance of our 4-year program focused on WHS management systems. Thank you for your time, and I'll hand back to Eva now.
Thank you, Nick. And thank you for sharing those insights and findings obtained from the Consultation, Cooperation and Coordination Proactive Inspection Program. I'm confident that many will benefit from this information and share those key takeaways with their respective organisations. Our next presenter is Justin Napier, General Manager of our Regulatory Operations Group. Welcome, Justin, and over to you.
Thanks, Eva, and thanks, Nick, and welcome everyone. Apologies for the technical issue earlier. It's great to see so many of you with us today as we announce our regulatory priorities for 2025-26. So this financial year, we have identified 5 regulatory priorities. These priorities are psychosocial hazards, contractor management. We will expand our silica priority from last year to include other airborne contaminants in 2025-26. We have a new priority area of workplace violence and aggression. And lastly, we will continue our focus on WHS management systems. A regulatory priority for Comcare. The regulations regarding psychosocial hazards are no longer new, and we now expect PCBUs to be implementing effective risk controls so far as reasonably practicable. Over the past few years, there's been a significant increase in both the quantity and costs of psychological claims, which tends to reflect the complexity of these cases. The average cost of these claims in 23-24 increased to approximately $350,000 per claim. This is more than 4 times the average cost of a physical injury or disease claim, which stands at around $80,000 per claim. So this highlights the need for effective prevention and early intervention initiatives and evidence-based management of psychosocial risks. In relation to our regulatory response, we'll take both a proactive and a responsive approach to regulating psychosocial hazards. Our psychosocial inspection program will continue to be rolled out within the jurisdiction and, after a successful pilot of the program, is now an ongoing proactive program. We will continue to respond to WHS concerns and incidents involving psychosocial hazards in a manner that is consistent with our triage processes and our compliance and enforcement policy. And we will continue to update our jurisdiction on any legislative changes arising from the Safe Work Australia review of the model WHS laws. We know from our employer surveys and our engagements, there's an interest across the jurisdiction in more advice and guidance on how best to assess psychosocial risks and how to respond to these risks in workplaces. With this in mind, we will continue to enhance our guidance and training resources across the coming year. Contractor management will remain a regulatory priority. Many of our regulated entities, both licensees and premium payers, utilise contractors to deliver services and to provide necessary technical expertise. A PCBU has the same responsibilities for contractors as for direct employees. That is, ensuring their health and safety so far as reasonably practicable. This includes risk management, consultation, and providing a safe work environment. Incidents involving contractors have been frequent and consistent across the past few years. There were more than 500 incidents in both 2023 and 2024, and based on notifications to date, the figures for this year are likely to remain consistent with this pattern. So we want to be sure that entities in our jurisdiction have a clear understanding of the WHS duties of contractor management. In so doing, we will enable PCBUs to better understand their duties and reduce the risks associated with work conducted by contractors. PCBUs must do what is reasonably practicable to eliminate or minimise the risks associated with those things over which they have control, and must provide the highest level of protection that is both possible and reasonable in the circumstances. Through the next year, we will be conducting targeted engagement with PCBUs that have high volumes of contractor engagement or a history of contractor-related incidents. We will be reinforcing shared duties across WHS legislation and helping PCBUs better understand their obligations when working alongside contractors, and we will be developing sector-specific compliance insights from incident data to inform more tailored guidance and regulatory focus. And internally, we will continue to build capability in our inspectorate relating to overlapping duties and shared responsibilities under the WHS Act. And we will also identify risk factors specific to contractor-heavy environments such as construction, transport, and government service delivery. Exposure to silica and related illnesses remains a priority in Comcare's jurisdiction. This year, we'll be expanding this priority to include other airborne contaminants. This combined approach will allow us to address a broader range of hazards in a more streamlined manner. Airborne contaminants are dusts, gases, fumes, vapours and mists that are released into the air from work processes. They can include welding and exhaust fumes, asbestos, chlorine, coal dust, silica, and other chemicals and gases. According to Safe Work Australia, 30% of Australian occupations have weekly exposure to airborne contaminants, with around 2.7 million Australian workers employed in these jobs. PCBUs must eliminate or minimise risks in the workplace so far as is reasonably practicable. This includes risks from airborne contaminants and ensuring that workers and others in the workplace are not exposed to levels of airborne contaminants above the relevant workplace exposure standard. Safe Work Australia published their 10-year Australian Work Health and Safety Strategy in 2023. Included in the strategy is a focus on increasing PCBU's awareness about their duties to protect workers from harmful substances, and a target of no new accelerated cases of silicosis by 2033. Safe Work Australia reports that there has been a rapid re-emergence of accelerated silicosis in Australian workers, mostly due to work being done with engineered stone. Comcare's education, compliance and enforcement activities will be designed to deliver on the target of no new cases of accelerated silicosis. Additionally, Safe Work Australia highlighted the need to better manage occupational risks associated with lung health more broadly, including exposure to airborne contaminants. The Safe Work Australia target is to achieve a 20% reduction in work-related respiratory disease by 2033. Workplace exposure standards have been reviewed and, in many cases, the exposure standard has been lowered to limit the concentration of airborne contaminants in Australian workplaces. These changes reflect the growing concern and oversight of this issue at a national level. In the past few years, incidents notified to Comcare relating to airborne contaminants have increased, with the majority of these incidents related to asbestos and gas exposures. We do acknowledge the risk of exposure to airborne contaminants is not a widespread issue across Comcare's jurisdiction. However, among some PCBUs, the risk is prevalent and real. Accordingly, in addition to responding to notified incidents and WHS concerns, where the exposure risk is heightened, we will be taking a proactive approach to ensure PCBUs and their contractors are complying with the law and taking active measures to manage these workplace risks. This priority will continue to be a focus for our specialist major infrastructure project team, and our regional inspectorate teams will respond to incidents and WHS concerns as they arise. With this in mind, our major infrastructure project inspectors have recently undertaken additional occupational hygiene training for increased awareness of these risks and their controls when out on site. This year, we're introducing a new regulatory priority: workplace violence and aggression. This new focus area is critical as we continue to work towards creating safer and healthier work environments for all. Workplace violence and aggression, also referred to as occupational violence, is classified as any incident where a person is abused, threatened, or assaulted at their workplace or while they are working. This violence and aggression can be either psychosocial or physical in nature and can occur at a worker's usual workplace, where the worker is working remotely, including if the person's workplace is their home, in a place where the worker is undertaking work at a different location, such as a client's home, or when a worker is engaging in a work-related activity, such as a work-related corporate event, or if you host a work-related social activity, such as a Christmas party. Violence and aggression may also be gendered in nature. And of course, there is now a positive duty introduced in December 2022 for employers to actively prevent workplace sexual harassment, sex discrimination, and other unlawful conduct. There are national data sets and reports that highlight a concerning trend of workplace violence and aggression. The ABS Personal Safety Survey from 2021-22 estimates that 8 million Australians have experienced violence since the age of 15. And according to Safe Work Australia's Workplace and Work-Related Violence and Aggression in Australia report, work-related incidents account for at least 13% of this number, which is over 1 million incidents. This survey indicated that work-related physical violence was more likely to be perpetrated by a client, patient, or a customer rather than a co-worker, employer, or manager. And reflecting the growing social and cultural awareness of this issue, the Commonwealth Workplace Protection Orders Bill of 2024 has been proposed to provide additional legal protections for Commonwealth PCBUs and workers. It will aim to deter acts of violence and other harmful behaviours by members of the public to Commonwealth workers. And last year, Safe Work Australia published a report that highlighted an increase in violence and aggression in Australian workplaces, with a focus on the psychosocial impacts of this on workers. So Comcare has received a number of notifications over the last few years related to workplace violence and aggression. And these incidents involve both workers and contractors. And we know that many PCBUs in Comcare's jurisdiction have significant client-facing functions. This includes customer service frontline roles that are either face-to-face or over the phone, and cover industries such as social services, regulation, law enforcement, case management, and banking and finance. With this in mind, through the next year, we will review our data to better understand the incidents that are occurring. We will engage with PCBUs on these risks to identify potential controls to better manage these risks. We will be engaging with high-risk PCBUs directly to ensure control measures are in place. And we will expect those PCBUs where there is a high risk of workplace violence or aggression to be actively managing these risks, and we will be engaging with these PCBUs directly. Effective WHS management systems are key to providing a framework to deliver improved WHS performance in an organisation. When well implemented, they can have a large-scale positive impact on the health and safety of workers. In 2025-26, we will continue to deliver the regulatory priority of WHS management systems through our regional engagement plan activities. Our focus this year will be on risk management. Throughout the year, Comcare will conduct proactive inspections with PCBUs in our jurisdiction to assess whether they have systems in place to enable effective WHS risk management. So think of risk management as a stepped process of identifying WHS hazards, assessing risks, controlling those risks, and then reviewing the efficacy of control measures over time or in response to an event. Effective risk management is necessary to support the principle that workers and other persons should be given the highest level of protection against harm to their health and safety. And my colleague Karen Palmer will talk more about this priority later in today's webinar. So in summary, these regulatory priorities will lead to a targeted focus of both proactive and reactive inspectorate activity. We will continue our research into these risks, and we will continue to share information and best practice approaches to the management of these risks. We have a range of resources on the priority areas available on the Comcare website, and will continue to promote these over the coming year. In addition, Comcare has a training team that offers online workshops. These are paid courses for those in the Commonwealth WHS jurisdiction. Some upcoming sessions for those in the some upcoming sessions include contractor management, psychosocial risk management, and bullying awareness and prevention. If you're interested in finding out more, the website address is on the screen and in the pinned post in the Q&A section. We also have a range of e-learns, which are self-paced free courses, and these are available on the Comcare LMS, our learning management system. Two highlighted on the screen are Bullying in the Workplace and An Introduction to Psychological Health and Safety in the Workplace. We also have an e-learn coming soon that will cover the basics of WHS risk management. So if you're an organisation in our scheme, we can provide access to a range of e-learns directly on your own LMS at no cost. More than 80 Comcare PCBUs are involved in that. So if you're interested in finding out more, contact the email address on the slide. So that's all from me for now. Back to you, Eva.
Thank you, Justin, and clearly some really important work for us all in our preventative efforts for these priority areas. Also some really excellent resources available to our scheme organisations. Now, as Justin introduced, our next proactive inspection program focus area is on risk management. And we have invited our next presenter, Dr. Tristan Casey, to speak today about risk management. Dr. Tristan Casey is a seasoned scientist practitioner with experience across private consulting, academia, and government. He's an endorsed organisational psychologist with over 15 years' expertise in the practical management of health, safety, and well-being. Dr. Casey has developed numerous award-winning training programs, measurement tools, and academic publications. He's a keen advocate of the positive links between safety, well-being, and overall job performance. A big welcome to you, Tristan, and over to you.
Thank you so much, Eva. Wonderful to be here and to have such a great audience here today to talk to about risk management. So very wonderful to see you all. I guess in terms of introducing, my presentation, I wanted to set the scene a little bit, and we might just request that we could go to the next slide. There we go. Thank you very much. The idea that risk management, of course, is about looking for and eradicating deficiencies in your business, such as things like identifying and controlling hazards. But it's also, I think, about establishing and embellishing what we call capabilities that contribute to success. So we heard some examples before about consultation activities to help improve the participation of the workforce and really encourage workforce proactivity to cope with changing situations. So it's really wanted to maybe do a little bit of challenging today, a bit of a new perspective on risk management, to say that it's a more balanced, holistic approach, avoidance of harm, and also approaching the opportunities to create successful work. So we can go to the next slide. Thank you. We'll do three key areas to focus on today, and here's some perhaps outcomes and ideas that we'll cover. If I summarize them into three areas, it's about our beliefs around safety itself, and we see the slide here redefining safety, so expanding our view of what safety and risk means. Then we'll transition into a little bit around designing risk management to cater for human factors. There's a lot of interesting, really important science coming out, particularly from the USA around Colorado State University. Matthew Hallowell, if you're familiar with him, the energy-based based approach. We'll talk a little bit about that and how that can be a really helpful tool to make risk management super practical for your workers and your workforce. And then lastly, some more high-level design considerations, thinking about how do we design our safety management systems, our risk management approaches, and also our leadership, which is part of that system of work, to what we call deep compliance, and really utilizing risk management processes as effectively as we can in organizations. So the overall aim is this sort of practical, straightforward presentation of this latest science. So there's a bit of science sprinkled through in risk management, compliance, and systems design. So hopefully you'll get something out of today that will help you move forward with your risk management maturity and your safety management system sophistication as well. We can go to the next slide. Thank you. So I wanted to start a little bit with this sort of reflection opportunity on how we typically define safety and what that means as a flow-on effect to the way that safety perhaps looks like and feels like in organizations. So typically we define safety as by its absence, by things being absent, being missing, the reduction of harm, the elimination of incidents or negative events that happen in our organization. And that sets up this really interesting sort of flow-on effect, that if we define things by its absence rather than by its presence, what are we really focusing on? Typically, we tend to focus then on deficiencies and problems and issues in our organization. And one of those issues that organizations can fall into the trap of is focusing a little too much on behavior as the cause of poor risk management. So they didn't comply, they missed something in their environment. There's a human element, a human error component to this poor risk management practice. And of course, there's always an element of truth in what we say, but is it helpful perhaps to focus exclusively on behavior? And is there a deeper story that helps set the context around that behavior? As a result of the behavioral focus, some organizations then perhaps create layers of bureaucracy and rules, requirements, constraints. They sort of tend to manage safety by reducing variability, reducing the opportunity for people to do things differently. Now, that's not to say that that approach, that constraint-based approach to safety, is not helpful. It definitely is. We've seen lots of improvements in safety performance as a result of rules and requirements and constraints on work. But what I wanted to encourage today is to think a little bit more holistically and say there's a time and place for that when we have perhaps critical risks in our business, the high energy hazards that can cause death or life-altering injuries for folks. That's definitely a time and place to have a very top-down approach to safety management. But what about all the other situations, and really challenge ourselves to think, is a one-size-fits-all to risk management and our safety management systems the best path forward? So next slide, please. Thank you. So in terms of flow-on effects, we can have of this sort of behavioral approach and perhaps an exclusive focus on things going wrong and deficiencies in our organizations. We get three key problems. The first is this kind of bureaucratic stuckness, where we have just too many rules and requirements for people to possibly keep in their heads. They're cognitively overwhelmed. And it creates a bit of a tension between getting the job done and the compliance requirements of the organization. Our businesses become so burdensome, so encumbered by excessive rules, and maybe some that aren't perhaps even required under law or legislation or even best practice. We sort of invent additional layers of requirements in our efforts, in our noble efforts to create safety in our organization, but sometimes that can go too far. The second key issue is we have this difference between the plans and the practice, or the way that we think work should be done and the way it's actually happening. So in a system or an organization where our management systems are rule heavy, requirement focused, burdensome, people will start to work around in order to achieve their goals. And that's where perhaps the risk can become introduced, and we drift away from where the organization thinks work is happening or what should be done, and into a more dangerous, risky zone where things are people are taking shortcuts perhaps to achieve their production or their efficiency goals. And the last key issue is around this idea of information. And when we focus so much on the absence of negatives in our organisation being an indicator of safety, paradoxically, as we get safer, we get less information to know what we do next. So we're almost penalised for our safety performance if we focus just on perhaps lost time injuries or even things like severity rates without that fuller suite of other leading indicators that tell us what the presence or the capabilities we need to achieve successful, safe outcomes in our business. So I guess this is perhaps setting up the stage for a bit of a burning platform. What do we do? How do we adopt more of a holistic, balanced view on safety and risk to move the needle forward? Next slide, please. And it's really this kind of combination of two perhaps seemingly contradictory ideas, but if we look deeper, they're actually complementary and sort of mutually helpful to have both happening simultaneously in our business. The first side of the equation, or the first side of the coin, is ensuring that few things go wrong. This kind of traditional approach to safety management and risk management, where compliance is something that we use to achieve that goal, and compliance with effective constraints and rules and requirements. We learn from the past, we look for things that go wrong and investigate and understand why, and perhaps adopt a bit of a holistic systems approach to understand what do we change about our organisation just as much as what we might be able to do with our people. And we avoid those past situations by implementing the improvements. So it's more of a reactive approach to safety. That's our sort of bread and butter, our traditional risk management approach. What the science and practice is starting to encourage us to do now is to say, not only do we ensure that few things go wrong, we have to ensure that many things go right. And what do we need? Well, we need the capabilities, the capacity in our organisation to allow people to have some adaptation, to be able to improvise when maybe the rule doesn't exist or is not effective for the situation. We also need to start moving and supplementing our reactive investigations to learn from just everyday work. And you might be wondering, why do we do that? Well, we learn from everyday work because that's the weak signals, the leading indicators that tell us that maybe a shortcut's been taken and just by chance or luck, nothing's gone wrong. But these perhaps deviations can also tell us a lot about how do we make work more successful. When people improvise and adapt and actually go beyond or better than the procedure that we've got in place, how can we take that learning and spread that through the rest of our organisation? And we shift lastly from a rearward past looking approach to more of a future looking approach to anticipate what can happen, what surprises might come our way, and preparing our people for those eventualities. So a balanced view, a holistic view of safety and risk helps us to have a more fully fledged approach when it comes to controlling hazards in our workplace. Next slide, please. Thank you. So we can start to think a little bit more about our definition, how we position the organisation and what the role and function of rules and systems might be. We can say that safety is also about the presence of capacity. And when I say capacity, I mean things like wiggle room, the buffer, the margin, the ability to have multiple options on the table when something is about to go wrong. When we have a very brittle, stable, predictable system that's full of rules and constraints, that eliminates capacity, because there's only really one way of doing the job as per the rule or per the requirement. We reduce proactivity, we reduce engagement potentially if it's an ineffective, burdensome system, and we lose our risk management capabilities. So behaviourally, we don't perhaps encourage mistakes, but we just accept that people will make mistakes. And so we plan to fail safely and sort of don't kid ourselves that we can eliminate or prevent every single error and mistake that happens in our workplaces. We aim to create safer systems rather than focusing so much on the safer people. So it's moving away from this perhaps older view that there's an unsafe personality, or, it's that stereotypical reason of complacency or people just not paying attention. Of course, there's an element of truth to that, but is it helpful to focus on that? What do we do with that information? Well, not really much, aside from maybe training the person or even performance managing them. Let's look deeper and say, what's the situation, the circumstances that led that person to have a limited sense of options around managing the risk in that situation. So we look deeper, we look beyond the human error, the human mistake, and say, where did that come from? Where did that originate in our system? There are multiple reasons why that particular behavior was showing at that time. And then we think differently about our rules and systems. Incidents and think wrong are a chance to streamline and optimize how we do things, not just necessarily add more layers. That might be a valid option if we have a glaring gap, but most of the time, when incidents happen, it's because maybe the procedure wasn't fit for purpose, maybe it wasn't adequate for the situation, maybe we had an opportunity to consult more widely and broadly to improve the quality of that procedure. Next slide, thank you. So to pause a little bit at this section and think to ourselves, a bit of a reflection opportunity, I guess, of the content we've covered. Are unsafe behaviours a cause of incidents? Are they cause of problems in our business, or are they more a symptom? And why might we think that? So a bit of opportunity to reflect on that statement. Do people come to work to get injured? Of course they don't. They come to work to earn a living, to get some meaning and purpose in their lives, to enjoy the people they work with. So to sort of assume that there's a problem with a person, or the people are an issue to control, that kind of underlying belief or assumption that sometimes underpins our safety management systems is not always helpful. And really the reality is they're just trying to make do. They're trying to navigate through the tensions, the competing demands, the goal conflicts, the limited resources and time pressure, just to do their jobs. And so by learning about those constraints through everyday work, learning about why people deviate, what the shortcut might have helped them to achieve, what frustrates them about the work, those types of questions help us uncover lots of really useful information to move our system forward. Next slide, please. So I wanted to change the tone a little bit now and talk about this energy-based approach to risk management. So again, some of the science and hopefully some practical ideas to help you think differently about how your organisation manages risk. Of course, we've got the lovely codes of practice and all the guidance material from Comcare and other state and territory regulators that tell us the process of risk management. But this, I guess, is a slightly different angle, which tells us kind of the why and a little bit about the how. We've got the what, we've got the model, the risk management cycle, of course, but what are we looking for within that model to really make a difference to the controlling of hazards? So William Haddon, he's this insurance person, he's an American fellow, and he came up with this idea called the energy-based approach, which built upon, as we do in safety science, many people that came before him. But he worked typically in traffic management and traffic accident analysis. And he thought, well, maybe there's something going on here around traffic incidents. We move away from perhaps, the behaviors of the driver and look at the system in which the driving is occurring. And through that approach, looking at the energies of the hazards that we experience in the driving industry or the driving context, how do we have a better series of controls to apply to those situations? Next slide, please. So Haddon was thinking, we can go on sort of categorizing things, counting and classifying, describing traffic accidents, or we could start to move to this different approach, which is explaining why these things happen. For example, we can classify and count different types of diseases. We can look at different types of rocks, for example, or different categories of animals. But we really want to understand, for example, with diseases, where do these things come from? And what are the underlying, perhaps, biological processes? What are the sedimentary ideas and sort of volcanic activity that create the different rocks? This sort of conceptual thinking is what really underpinned his approach to energy-based management of risk. And sort of changing the approach, which was revolutionary at the time, to look more holistically at the system in which risks come to fruition and how do we manage those more effectively. Next slide, please. So Haddon's idea was this sort of sequence that if we backtrack from the harm or loss event, the things that can go wrong, we can have perhaps the energy source, which we might equate with the hazard. There's some sort of barrier or defense, and Haddon was a big advocate for not just saying, do these things exist, but also assessing the quality the quality and the effectiveness of those barriers and defences from the hazardous energies, which is really an underpinning concept that comes very strongly in critical risk management frameworks. This notion of critical controls and the effectiveness of those controls, verification activities, checking and ensuring that not only have we got those things in place, but are they working? Do they have integrity? Do people know how to use them and how they work when it really matters most? So it contributed a lot to the thinking around critical risk management. Then the third element is the person, the target, the property, whatever the hazardous energy might be acting on. And those targets might have some different susceptibilities or vulnerabilities to the harmful energy, depending upon what we're talking about. If we apply this thinking to psychosocial risk management, of course, it makes sense. People were with perhaps pre-existing illnesses or injuries, different life experiences, certain personality traits may be more susceptible to psychosocial hazards than others. And so we have to adapt our system of risk management to cater for those individual differences. So hazard plus barrier plus target, all those things lining up to produce the harm or loss event if there's inadequacies or ineffectiveness amongst those three elements. Next slide, please. So another key concept that Haddon promoted was really the foundations of the hierarchy. The higher the control strategy must be, or the more upstream it must be, to focus on the source rather than the effects. What that means in practice, rather than relying on our administrative controls, our PPE, our mitigating controls, perhaps, we focus more on the preventative side of things. So our significant critical risks, things like working with live electricity, the priorities that were shared by Comcare, of course, the areas of focus. We should shift our focus up to dealing with the hazard itself rather than the downstream, perhaps the barrier or the target. So next slide, thank you. Again, just to highlight and reinforce that when we have, if we operationalize and put Haddon's thinking into practice, we have to focus on the integrity of our barriers and defences. We have to evaluate them, we have to monitor them, we have to verify that, for example, we've got lockout tagout in place. Are people capable of using that process? Is the bureaucratic kind of system around that lockout tagout effective and efficient, so people don't work around it? All these different elements to help us understand the adequacy and effectiveness of that particular barrier. Without that assessment, we cannot be confident that our control measures are going to be functional and effective when we need them. Next slide, please. Here's just a couple of examples to work through. So if we think about different sorts of control measures that Haddon's model might encourage us to look at, we can focus upstream on the hazard if we're talking about, working with live electricity, for appropriate grounding, reducing static potential, reducing the voltage or the current, so reducing the intensity of the hazard, acting on the energy itself to prevent that energy from either being released or reducing its intensity, basically acting on the source of the risk. The second key strategies would be around the barrier. So the circuit breakers in place, lockout tagout systems, for example, sort of like the acts or the systems we put in place to create some distance in time or space between the hazard and the target, the person or the property. And then our mitigating hazards are really our bread and butter PPE and more administrative type controls. So wearing our arc flash suits, for example, in the case of switching activities, or insulated tools to prevent perhaps electrocution if someone does inadvertently touch the live energy. So Haddon encourages us to think in a more holistic kind of energy-based way around how to effectively manage hazards in our workplace. And it's a nice sort of simple, straightforward theory and model that encourages us to have a very high quality risk management system in our organizations. Next slide, please. So in terms of reflection of this little section here, just encourage you to think to yourself, which of hazard strategies are most perhaps frequent or prominent at your site, your organization? Does your organization tend to focus its controls on maybe the target, the mitigating controls, lots of PPE, lots of administrative controls? Are you focused on the barriers, the systems in place that create time and space, a gap between the target and the hazard? Or do you have perhaps more of a focus on the upstream hazard, particularly for your critical risks? It's a way to reflect on and assess the adequacy of your risk management system in your organization. Do you have a full cohesive suite of control measures across the three different areas, the hazard, the barrier, the target? Or perhaps do you have an imbalance, maybe more of a shift towards the target and the mitigating effects, which ultimately create more risk for you and your business and the people that you're doing your work? Okay, next slide, thank you. So situational awareness is something that comes up a lot, and we hear the word complacency. Poor hazard identification. Is that just something that we have to accept? Is it something that just is part of being human, or is it more something we can understand and start to plan for? So this sort of idea of we identify the hazard, we have to perceive that the hazard is a risk. And then there's also a third element to the equation, which is individual tolerance for risk. And they've been doing the same job for a long time. Potentially they can build that perhaps tolerance to the risk and don't see or fear it as much as perhaps someone new to the industry. So the current science that's coming out around this idea of complacency is maybe it's less helpful to label it as such. Instead of labeling it as complacency, think about it as perhaps our bias, our perhaps limitation as human beings around the way that we identify, perceive, and potentially tolerate risks in the organization. Let's have a look at what this means more practically as we start to apply the energy-based approach to risk management. So next slide, please. What the research says, well, there's some pretty compelling data that's coming out at the moment, which says that roughly 45% of hazards are identified by workers. So when workers are missing a lot of the things that can kill or seriously injure them in the workplace. 35% of those hazards are missed due to perhaps what we might call blind spots, which is that biological limitation that we have around energy-based hazards. Some hazards are more intuitive and obvious than others. And 20% of hazards are missed due to the changing nature of the job. As the job proceeds, we're not doing that ongoing dynamic risk management, just risk assessment and management approach. We're rather just maybe sticking with the pre-start meeting, the initial setup of the job, getting on with the task, and perhaps the situation changes, surprise will come up, and our systems are failing to respond to that change by prompting people to perhaps to do another risk assessment process. Some really interesting data, the fact that we miss so many hazards. A lot of those hazards that we miss are perhaps due to biological limitations or the way that we perceive risk in the world. And we're not very good at responding to changing conditions. So 3 key areas or hotspots for our risk management processes and systems in our organizations. Next slide, please. So what the research says more particularly is that we use less energy, and it's easier to find energies that are related to gravity and motion. So, for example, falls from height, moving plant or objects. These are things that people will intuitively be drawn to and perhaps notice as part of the risk assessment process. Where we fall down and where the brain requires more energy, where it's less intuitive, are hazards that involve mechanical energies, pressure, pressured fluids or liquids, and excessive extreme temperatures. So things that are perhaps less obvious, more human-made in their nature, requires more energy, more cognitive energy, and hence we tend to miss them. And lastly, we're more likely to identify hazards that we have an emotional connection with. So the importance of storytelling, talking richly about incidents, unpacking them with people, and highlighting the potential consequences for some of these incidents in terms of creating that emotional pull, that emotional connection that encourages them to pay attention to them and deal with them with the significance that they deserve. Next slide, please. So we can take a quick example and think, what are our eyes immediately drawn to? I would suspect it would be the suspended load. If you were looking at this and we did a little experiment, most of us, our eyes would immediately come to see that load being supported by the crane. And other hazards may be less obvious or less forthcoming. And that's really an interesting point for when it comes to assessing the quality and effectiveness of our risk management systems and organizations. What are our people focused on? What are they missing? And engaging them in high quality conversations to try and tease out and pull out that more cognitively effortful hazard identification process. So missing things like psychosocial risks, missing things like, perhaps stored pressure or hydraulic pressure, for example, in different equipment and machinery, things that aren't immediately obvious that we tend to miss as we do that risk assessment process. Next slide, please. So using an energy-based framework is really helpful because we focus on sticky stuff that kills us. There's other words for it, but we tend to use the stuff that kills you. Simplify the discussions about hazards by focusing on what are the energies that could cause serious harm or death. And that tends to really hone in the conversation on the things that matter. Secondly, we want to use this philosophy or this thinking around building capacity to fail safely. So we're not saying that we definitely will fail. We're saying, what if? Encouraging us to go beyond just the identification and control of what's immediately in front of us, but saying, well, if those controls are ineffective or something happens as a human error or human mistake, we want to ensure that any energy that escapes is still mitigated and we don't lose people or we don't have life-altering injuries. So try and ask the question, how can we build capacity to fail safely? And lastly, Haddon tells us that our controls, defenses, our barriers can erode over time. So focusing our effort on verification and ensuring the integrity of our controls are monitored over time as the job unfolds. Okay, next slide. If we apply the energy wheel, this sort of energy-based concept, we start to see a 30% improvement on hazards being identified. We increase the structure and the quality of our discussions on risk. People start to apply it during the job, so that changing conditions, we're more likely to notice that and apply our risk management processes dynamically. And a couple of key points with applying the wheel of the idea of energy-based management is, ask people to use their instincts, what's intuitive, and then what's not. What are we missing? What are the other energies that perhaps are present in this work situation that we could perhaps mitigate or manage? So the energy process helps us to have more effective risk management systems. Next slide, thank you. Coming to the end of my presentation now, just to sort of give you some tips and ideas about designing your entire management system for what we call deep compliance. I wanted to start just by giving you an idea of what deep compliance means. You might not be familiar with that term. So rather than focusing on the quantity of compliance, we think about the quality. Do we have superficial surface compliance, tick the box on our risk management activities, or do we have deep compliance where people are fully engaging with the intent, the value, the purpose of those activities and thinking to themselves, yes, I'm fully aware of what is in front of me in terms of risk. I can see the benefits of why these activities are in place. Even when I'm under pressure or stress, I will continue to comply with those risk management tasks or activities. And I've incorporated them into my habits and my routines over time. So this is the kind of mindset that we're trying to encourage and instill in workers as they go about their work and in conjunction with risk management systems that we've implemented in our organisation. So aim for deep compliance when you're designing your systems and your activities for safety management. Next slide, please. How do we do that? Well, there's two different levels, which I'll finish on now, is the organizational level. So the design of the systems, focus on the stuff that kills us, as we mentioned. Focus on the critical risks and controls in your business. What are the things that can cause significant harm or loss? And invest your energy and attention on those first. And then the more lower level risks perhaps can start to be managed thereafter. So we only have limited resources, limited time, limited budget. So if we focus on the critical things in our business that will cause serious harm or loss, that's going to enable more effective risk management. We want to learn from workers that everyday work concepts, spend time consulting, engaging, and understanding how your systems actually flow through to affect the work. Are we increasing tension and constraints? Are we making the work more difficult, more burdensome, more cumbersome? Or are our systems more seen as a resource, as a tool in the workers' toolkit that they apply as they go about their tasks? And of course, think about how our rules, our systems, our activities, how will that shape the work? How will it affect the way that people do their jobs? And sort of a, more of an efficient, cost-effective model way of thinking. And last slide, thank you. And just to finish on, leadership is, of course, really crucial when it comes to workers' behaviour and compliance. And this is a little evidence-based model that might help you focus your safety leadership programs, protect, promote, participate. Research-based model that helps to encourage deep compliance. We want to protect our people from production pressure, shield them the front line, give them the resources they need to be successful in the time to make safety work. So that's what protect's all about. Promote is more of this sort of cultural or value and importance of safety, the typical management commitment to safety type concept. And lastly, participate is being an active role model by actually being part of the safety activity, showing people what good looks like, being part of the work, and engaging in those activities alongside your workers. So hopefully that was a bit of useful information. That's all from me. And I imagine we have some questions at the end of our session, but thank you.
Thank you, Tristan. You've shared some really important literature and some fascinating insights and ideas that both challenge and cause us to consider how we define safety, the importance of building capacity to fail safely. I loved that one, and also applying the energy wheel in our hazard identification. So thank you so much for sharing that with us. Now we are going over time just by about 5 minutes, so we do appreciate you staying with us. Our next presenter is Peter Davies, our ACT Regional Director, and also Karen Palmer, who is a Senior Inspector. Now, they will be taking us through how and what to expect of the Proactive Inspection Program on risk management. So thank you very much, Peter and Karen.
Thanks, Eva. I hope everybody can hear me, and good morning, afternoon, and potentially good evening, depending on where you are in the world today. Today, Karen and I will seek to provide you with a brief overview of Comcare's 25-26 Proactive Regulatory Program. The areas that we will be covering off will include what the program is about, what you can expect within the program, and how you can best prepare for the inspection. Now, Nick mentioned earlier in the session that the aim of the program is to ensure PCBUs have systems and arrangements in place to enable them to meet their duties and obligations under the WHS Act. To this end, Comcare conducts a 4-year rolling program of proactive inspections to review these systems and arrangements. And hopefully you or your members will have participated in at least one of those programs by now, because we've been running it for 2 years. The initial program looked at incident management systems and arrangements, and most recently, last year, we've completed our program examining consultation, cooperation and coordination. As noted by Justin, the focus of our program this year is on risk management, and obviously that's what you've just received an interesting brief on. And next year's focus will be on due diligence. I'll now hand over to Karen, who will provide some more detail on the 25-26 risk management program. Over to you, Karen.
Thanks, Peter. The inspections are carried out in 2 parts, a documented review and an on-site inspection. Documents are requested from the PCBU, and when received, they are assessed using a standardised checklist. The checklist is specifically created for each program, developed in consultation with key stakeholders. Information used to create each program checklist comes from the approved codes of practice, Australian standards, regulatory guidance material, Work Health and Safety Regulations Part 3.1 around managing risks to health and safety at work, and the ISO standard for 45001 occupational health and safety management systems, and ISO 31000 for risk management. Once the documents have been assessed against the checklist, inspectors attend a site visit with the person responsible for WH oversight. This can be a dedicated WHS manager or a HR manager responsible for WHS. During the site inspection, the inspectors will run through their findings and speak with the worker, the HSR, and the contractor where applicable to ensure the documented processes are communicated effectively and applied consistently. Inspectors understand that PCBUs have competing priorities and take this into consideration when we schedule these inspections. However, participation is required. It is also too important to note that when inspectors enter the workplace, the inspectors will show their identification and they'll explain that their entry to the workplace is done so under powers in accordance with the Work Health and Safety Act. Although the inspection is proactive in nature, inspectors will still be able to exercise their regulatory powers should they need to do so. The process for the inspections is as follows. The inspectors contact the point of contact for the PCBU. And as previously stated, this person will be the person responsible for WHS oversight. It could be a dedicated WHS manager, as I said before, or a HR manager, etc. Inspectors will discuss the scope of the program, the documents requested, and the timeframes for the inspection. Generally, documents are received within 2 weeks after the initial contact, with the site visits scheduled for the following week or thereabouts where possible. A confirmation email will then be sent to the point of contact confirming the requested documents and the agreed timelines. Documents are received and reviewed against the checklist. Following the document review, the inspectors will attend the site inspection. The inspection usually lasts between 60 to 90 minutes to run through the findings against the checklist from the documents that have been supplied. The inspectors will undertake the interviews with the worker, the HSR, and the contractor at this time. It's up to the worker, the HSR, and the contractor if they wish to have that contact person present. It's entirely their decision. If the site visit cannot be undertaken physically due to geographical location, for example, the point of contact might be in Brisbane and the inspector assigned may be in Melbourne. Inspections can be carried out via MS Teams as a virtual site inspection. An inspector report will be issued to the contact person detailing what elements of the checklist were able to be demonstrated and highlight any potential opportunities to improve their systems and processes to ensure ongoing compliance. Of note to the PCBUs, if you don't have one of the documents that has been requested, don't go out and create the document. This will be reflected in the inspector report. The information that the inspectors are looking for is your safety management systems that include your work health and safety policy, your risk management framework, incident reporting procedures, and roles and responsibilities. With respect to the risk management framework, inspectors are looking for the process being demonstrated and showing how the business ranks or evaluates its risks. Looking for evidence of WHS training that's relevant to the workplace, such as hazard identification, risk assessment and control training, and other WHS-specific training packages which may be viewed during the site inspection through the learning management system. Looking for the last 2 WHS or consultative committee meeting minutes where workers have participated in decision-making in relation to managing WHS risks and hazards that have been identified, and the applicable and appropriate control measures. Looking for operational risk assessments, this is not the corporate risk register. This is a line item from that register to demonstrate consultation with workers or their representatives about control measures that have been implemented. Evidence of this may also come from the WHS committee meeting minutes or email correspondence to all workers calling for comment or feedback on the identified hazards or significant job task. We want to see the risk management process has been applied from start to finish. For an example, when an incident occurs, it's investigated to identify the root cause. Corrective actions are identified to mitigate the risks or reduce reoccurrence. Workers are given an opportunity to provide feedback about the proposed controls or corrective actions and how they can be communicated across the agency or the business. We look to see the current list of HSRs. Inspectors will select a HSR from the list to participate in the engagement. Ideally, this HSR will be from the work group in that location where it is possible. We might ask to see other documents or verify other activities are taking place. We might look at training records or incident management platform or the like. As per our normal processes, you will receive an inspector report detailing the findings of the inspection and any recommendations on compliance anomalies. As always, feel free to chat with the inspector if there are any concerns, and we look forward to engaging with you very soon.
Thank you, Karen and Peter. I'm sure the information provided has alleviated some uncertainty and also offered valuable insight to our attendees regarding what to expect. So I'd like to thank all our speakers for your presentations. Now we are at question time. However, we do only have time for a few questions, so I do appreciate and thank you for staying online with us. If you do have a question that we don't get to, please do reach out to our Work Health Safety Help Desk and we can respond to you there. So, who am I going to put in the hot seat? I've got a question here, Tristan, which I might throw to you. And that is, how do you see AI integrating with safety management systems to provide better outcomes?
Yeah, interesting, very topical. No, I'm not. I'll just preface this. I'm not an AI expert, but it does very much intrigue me. I think if you peel back the question a bit, there's definitely some fundamental ethical kind of quandaries and dilemmas with introducing AI. But if I could sort of give a couple of principles, I think it's about augmenting, not replacing. So the example might be, self-driving cars versus more adaptive driving features. I think, we sort of want to try and augment the human experience and make it work better and more effective, more meaningful, rather than seek to replace people. I think secondly, it's about supporting, not surveilling. So using, CCTV and AI in that respect more as an education and training tool rather than a performance, perhaps discipline tool. Connecting, not isolating. So ensuring equity of access and that we create more networks and trust across our businesses rather than maybe dividing people into the have and have-nots. And lastly, I think enhance your system, not replicate what you're doing now. So there's a temptation, I think, with AI to digitize existing processes without streamlining and improving them. So we run the risk of just increasing the burden, 100-fold if we just run everything through AI rather than thinking about, is this actually helpful and driving the right outcomes for our people? So, yeah, a few ideas.
Great. Thanks, Tristan. Okay, Justin, I've got one that I think I might give to you. We've got a question here. What are some key things we can do to prevent the exposure to psychosocial hazards and psychosocial injuries?
Yeah, thanks, Eva. I think a really good point is to refer to the Commonwealth Code of Practice, which steps out a process for, in essence, assessing the risks within an organisation, identifying the hazards and then assessing the risks and then putting in place controls, and then that ongoing need to review and monitor and reflect on whether the hazards are still pertinent or they've changed and whether the controls are effective. So it picks up a lot of what we've been talking about in this webinar to date. I think fundamental to the assessment of those risks is knowing your business. There's a requirement, hopefully everyone's well familiar with, to consult with workers in relation to some of those hazards. The presentation that Karen and Pete just did talked about our engagements that we'll be undertaking to ensure or assure ourselves that risk management approach is embedded in your business. And then it's about the controls and the frameworks that can be put in place, and probably there is a hierarchy of controls, which is a requirement to apply in the assessment of psych risks in the Commonwealth jurisdiction. And often, if you cannot eliminate the risks, the next best starting point is to look at the design of the work that's undertaken, to see whether there are adjustments that can be made to that work, how it's performed, breaks, elimination of particular hazards. And this is all stepped out in the Commonwealth Code of Practice as a sort of as an approach to follow. There's also tools out there to assist organisations in engaging with workers to understand what are those hazards in the workplace. In many cases in the Commonwealth jurisdiction, there are commonalities in the types of work that are done across PCBUs. So engage with other PCBUs, understand what they're doing. Yeah, there's a lot we could say about this, but a really good starting point is that code of practice. There's also information on Comcare's website, Safe Work Australia's website and the like. So yeah, that's probably a really good place to start. Incident data, encourage your people if there are psych issues emerging, even if they don't manifest as a particular injury, to encourage them to report that, which gives you really valuable intelligence in relation to the types of psych hazards that might be prevalent. Encourage a no blame culture. It's really about that, you know, the risk management process of assessing those risks and then putting in place appropriate controls. And I think there's a growing body of knowledge across WHS in relation to what good looks like, what good practice looks like in response to a number of those hazards. And going back to the psych code, sorry, there's 17 psych hazards that are identified in that psych code of practice. So they're a really good place to start. And you should be asking yourselves whether any of those apply in your workplaces. And I stress workplaces because it's not just a sort of one size fits all. Many of the organisations that we regulate are quite large. You've got different types of work performed, often in different locations. So you do need to be asking yourself whether those hazards are prevalent across the various workplaces that you have, not just a sort of one size fits all. So hopefully that's a pretty quick answer to a pretty complex question, but thanks, Eva.
Thanks, Justin. And I think I have a bit more time just to sneak in one last question. Nick, I've got one for you here. We are about to enter the third year of Comcare's new proactive regulatory approach. What are the lessons learnt that you have seen out of the 2 years to date? Are there positive takeaways that you are seeing with the Comcare staff?
Thanks, Eva. Well, so far, it's been a really great way to engage with the jurisdiction in a more preventative lens, and working with the PCBUs to identify, the key improvements in their systems, which of course leads to safer workplaces. We've engaged with a broad range of PCBUs, workers, and HSRs and others, and it's provided an opportunity for other conversations and sharing of information too, but not just with our inspectors and the PCBUs, but equally between PCBUs. So it's fabulous. Our inspectors are really gaining a better understanding of the work across the jurisdiction and the varying arrangements, for both large and small PCBUs. And the feedback we've received has been great, as I mentioned earlier, with an increased satisfaction 2 years in a row about our proactive inspection. So it's really positive for us to see and encouraging that we're making an impact to safety.
Thanks, Nick. So that does bring us to the end of our session today. I really do thank you for bearing with us through some technological challenges we did have this morning, but I think we did get there in the end. So thank you very much for your attendance and your involvement. A big thank you to our speakers, Nick, Justin, Tristan, Peter and Karen, for your presentations. Before you log off, we'd greatly appreciate you taking some time to complete the short survey that we will email out to you. It is also available by scanning the QR code that you can see on the screens. And there is also a link to it in the pinned Q&A post. Stay up to date with us by subscribing to eNews and by following Comcare on LinkedIn. By doing this, you will be notified as we develop and release the latest research, resources and upcoming events. And as mentioned earlier, this recording will be available on Comcare's website for viewing or sharing with your work colleagues that may not have been able to attend today's session. So thank you once again, take care and stay safe, and we do hope to see you again soon.